Welcome to the Breech Birth podcast. I'm Sasha Hopkins, private midwife, breech birth educator, and your host. This is a space to hear the real, raw, and powerful stories of women who have experienced breech birth in all its layers. Each episode features honest conversations with women who've experienced breech firsthand, offering insight and reflection. This podcast was born from the knowing that these stories need to be heard, to inform, connect, and reclaim the story of breech birth. Whether you're navigating breech birth yourself, supporting others, or simply curious, welcome and thank you. Hi, Jillian. Welcome to the podcast.
Hello. Thank you for having me.
Before we get going into your story, can we start with some context questions? Can you tell me what year your breech baby was born?
This year, 2025.
And what location are you?
I live in Phoenix, Arizona in the United States.
And what kind of care did you receive?
So I had a little mix of everything. I had obstetric from an OBGYN here in Phoenix. The midwife my husband and I chose to actually deliver our baby was a midwife in California, so the neighboring state next door.
And how many weeks were you when you had your baby?
41.
On the dot.
Mm-hmm.
Did you have a vaginal birth or a cesarean?
Cesarean.
Thank you. Do you want to tell us a little bit about yourself before you dive into your story?
Sure. I am a midwife student in my second year at the University of Arizona for a certified nurse midwife. I worked in a hospital for the last 3 years in critical care, and I knew that I did not want to be a midwife in the hospital. And I also have my doula certification. I'm a hairdresser and also a yoga instructor, so I kind of do a little bit of everything.
Amazing. Many hats.
Yes.
Beautiful. Thank you. Do you want to go into your story? Start from the beginning. Have you had any other children or just the one?
So this is my first child, my third pregnancy. My husband and I started trying just after we got married in 2023, and we got pregnant almost right away. And that ended in a miscarriage very early on, like around the 4 or 5 weeks. So we pretty much got our due date, and a few days later I started bleeding. So we waited a month, and then we tried again, and we got pregnant again. And that pregnancy I took 8 weeks, and then I had another miscarriage. And from there, we got in touch with friends who recommended an OB because the midwife we were working with through the miscarriages thought maybe there was something we might want to look a little bit further into. So we got a referral on an OB, and he started looking into things, looking into my husband's sperm, looking into my eggs, all of that stuff. And after all of that, he pretty much said that everything looked fine. He couldn't really tell that there was necessarily a reason why we were having the miscarriages. And he said 50% of the time you can tell there's an actual reason why, and then 50% of the time they just happen. So he's like, you're in the latter category and it's just happening. So whenever you guys want to try again, if you're up for trying again, I don't see any reason why you can't or shouldn't. So we tried again and ended up conceiving. And he put me on progesterone because he thought maybe it was a lack of progesterone to support this pregnancies. And he's like, that's an easy thing we can try. So we did that and got pregnant. So carried her 41 weeks and had a little girl in April of this year.
Amazing. And what was your pregnancy journey like? Because you said you had a bit of mixed care. So how did that look? Did you know who you wanted when you started?
When I started with the pregnancy?
Yeah.
So when we started, because I knew that I always wanted I thought birthing center initially, and then the more I thought about it, I realized that I wanted a home birth. So that's why we were previously following with a midwife, and then with the miscarriages got set up with our OB. We conceived with the OB. And so because we were already with him getting pregnant, we kind of just stuck with him. And I actually really liked him as well. He is actually the only OB in his practice, and the rest are midwives. So his wife is a midwife there, and then he works with all midwives. So for being an obstetrician, he had a lot of midwifery philosophy that he also practiced by, which I liked. But I knew when it came to delivery, I wanted a home birth, and he didn't do home birth. So I knew that I was going to have to transfer eventually to a midwife when it got closer. So at around 17 weeks pregnant, I flew out to California for my doula certification. And the midwife who was leading that training, she kind of seemed like my of all end all, like dream, caretaker or person to do our delivery, but she was in California. And with us being in Phoenix, I was like, oh, there's going to be no way. We don't even live in the same town, right? And it was a weekend long doula trainings. And on the second day of the training, I just asked her, would you be open to doing our delivery, even though we live in California or in Arizona? And she said, yes, she does lots of out of state, even out of country deliveries. People come in to have her deliver babies all the time. So we signed on with her at 17 weeks, and she just recommended that when we go back home to Arizona to just continue with our OB reaching out to her whenever we had questions or if we ever had concerns that he wasn't aligning with how we were wanting to do things. So we kind of just had both of them then, him physically here and then her a short phone call away from 17 weeks until 38 weeks. And at 38 weeks, my husband and I got in the car and then we drove out to California and had an Airbnb.
So the plan was to birth in California then?
Correct. Yep, that was the plan.
Did your OB know that you were planning a home birth?
Not exactly. He knew that we were previously with midwifery care prior with the miscarriages. And then we came and saw him when we were looking for further help to conceive. So he knew that we were previously with that line of care. When we got with him, we just stuck with him. And at around 36 weeks, he was like, we need to start talking about delivery. What does that look like? And that's when I told him, we actually are going to deliver with a friend of mine who's a midwife in California. You've been great. You've honored everything that we've wanted thus far. And I appreciate that. So it's nothing personal. It's just our personal wishes to deliver outside of a hospital setting. And he was cute. He was like, oh my gosh, like totally respect that. But I've been with you this whole time and, I would love to meet your baby after all of this, but I get it. And I respect your wishes. So it was bittersweet. I could tell he was, I don't know if sad is the right, disappointed maybe. But he respected us.
That's good. Yeah. And how was your pregnancy? Was there any issues? Did you get morning sickness or all day sickness?
Yeah, exactly. Right. All day sickness for the first maybe 14 weeks. And then it subsided. Second trimester was great. I was walking. I had really no aversions or cravings. Probably the best I felt up until probably about 29, 30 weeks. And then I still felt relatively good. I just started getting food aversions. And I also just got really tired, which is pretty normal. And because I align with more of an all natural process, right? Like I wanted to be at home. I wanted the least interventions as possible is what I personally wished. My husband was also right in line with me on that. So, I always thought that I would never have a pregnancy with all the ultrasounds and everything. With the miscarriages, I had some little seeds of doubt that would kind of pop up throughout the pregnancy, which I tried my best to go back to my yoga training and just breathe and find positive thoughts and all of that. But I would say 75% of the pregnancy I felt great and was positive, but there was definitely that 25% that just based on my own personal journey with trying to have a child, the little seeds of negativity or doubt would kind of creep in. And then I would beat myself up with that. Right. So yeah, overall, I felt pretty good.
And so you said you went over to California. How far a drive is that?
Yeah, it was about 5.5 hours.
Okay, so pretty decent.
Mm-hmm. Mm-hmm.
And you said at 38 weeks, you're thinking baby's head down at this point?
Well, and baby was head down. So because we were with an obstetrician and because of my previous miscarriages, they had put me in a high risk category. So I was having ultrasounds. Again, I never thought I would have that many ultrasounds, let alone as many as they were doing because of the previous miscarriages. For the first 28 weeks, it's once a month. So every 4 weeks I had an ultrasound. And so at 28 weeks, baby was head down. At 30 weeks, baby was head down. And then at 32 weeks, baby was head down. And from that point on, I said, listen, we're 32 weeks, baby's big, baby's head down. I'm going to withhold any more ultrasounds. I don't want any more. We're at the tail end of this pregnancy. So I actually withdrew any more ultrasounds, even though I was still here in Phoenix for a few more weeks before that 38-week mark. Yeah, baby must have flipped somewhere between 32 and then that 38-week mark. So we went to California on 38 weeks exactly. We stopped every couple hours on our journey over there, if not every hour, because I was very pregnant and, having to use the toilet. Yeah. So we got to California. It was a relatively easy drive. It was a Friday when we got there. I wasn't seeing the midwife until that following Tuesday. So 38 and 3 days. And so my husband and I got there. We had a nice weekend. We went for walks on the beach. We just kind of did what we were doing here in Phoenix, just in a beach environment. And on that first appointment with the midwife, we went in, we were so excited to see one another. She's like, baby's head down. I'm like, yep, since 30 weeks, we're great. She was like, okay, do you mind if I just feel for myself quick? And I was like, not at all. So I laid down, she started palpating my belly and she was like, she was kind of under my left rib on my left side. And she was like, baby's head down. And I'm like, yeah, baby's head down. She's like, okay, if I didn't know better, I feel like this is the head right here. And she was like, do you mind if I do a little ultrasound with my phone quick to kind of just verify? And I was like, not at all. So she did a quick little phone ultrasound, and sure enough, baby was transverse. So baby was head on the left, butt on the right. And at that point, we didn't necessarily know where the feet were. She was like, okay, no problem. You're 38 and 4. We've got plenty of time to get baby head down. So don't worry about it. So I was like, okay. So she did an ECV. She explained to me an ECV and then attempted one there in our office. And then she works with a chiropractor. So she sent us over to the chiropractor who did a Webster maneuver. Baby did not move. So then she gave me the name of an acupuncturist there in California. So we went and made an appointment with her and did acupuncture. Then waited a few days, I think on Thursday. So like 38 and 6, went back to the midwife office. They checked again. Baby was still transverse. She attempted another ECV. She attempted another Webster's because she didn't move on the ECV. So then we did another Webster and nothing. She was like, it's okay. Go home, take a bath, have a nice relaxing weekend, maybe do some Epsom salt baths. Just keep as relaxed as you can. We're all good. So then we went through that weekend, just normal. Again, walks on the beach, all of that. I did the baths with Epsom salt. And then we came to that following Tuesday. So 39 weeks and 4 days, and went back into the office. Baby was still in the same presentation of transverse. And at that point, she was like, I'm gonna do an actual ultrasound with an ultrasound tech here in the office just to really look at baby's size and if there's an umbilical cord and that's prohibiting baby from turning, just kind of get a more clear image as to what's happening. So we did an ultrasound. Everything looked great. She said she didn't think she could see a cord around the neck. So from what they could tell, they didn't see anything inhibiting why baby wasn't able to turn. So she was like, if you're up for it, let's try a third ECV and maybe third round of chiropractic. And each time she did the ECV, the baby would kind of move, right? But then would come back. So the baby would kind of start to go head down, but then boom, like tracked back up. Attempt both ECV and Webster, and baby did not move again. So she took me back into her office and was like, okay, now is when we need to have a conversation. You're 39 and a half weeks. Baby is as big as it's ever been. She was like, you're my patient, but so is your baby. And I have to honor both of you. And she recognized the fact that we had come out there and booked an Airbnb for a month and all the things that we had done to try to make this be how my baby was going to come. But she was like, I also have to honor your baby at this point, and your baby is not wanting to turn. I'm not sure why baby's not wanting to turn, but I have a pretty good success rate with ECVs, and baby is just not wanting to move. Oh, and then that was when she also said, and in California, midwives cannot do breech delivery. So being that you're here now in our state, legally, I cannot deliver at home for you. We could call an obstetrician in, and an obstetrician can do a home breech delivery in California. And I have plenty of obstetricians I can call to ask, A, it's going to be an added expense for you and your family, because you'll have to pay them also. She's like, but B, I can tell you right now that your particular breech isn't a very high likelihood that an OB is going to come and do a home delivery for you because of the actual breech that your baby's in. And I was like, what does that mean? And she was like, well, your baby's in footling breech. And I had never even heard that as a midwife student. I had never even heard of footling. I knew complete and I knew,
Frank?
what is it? Yes, thank you, Frank. But I had never heard of footling. So I was like, what is a footling breech? And she's like, footling is when your baby's feet are in your pelvis. And an obstetrician probably isn't going to sign on for this presentation because of the risks associated, unfortunately. You can either wait to go into labor here spontaneously, and then you need to hightail it to a hospital and get a cesarean, or you can get in the car and drive back to Arizona and get back in touch under the care of the OB that you've been following with this whole time in Arizona to do your cesarean. Because she was like, unfortunately for this presentation, cesarean is really kind of your only options or your safest option. And to be honest, when she told me that news, I think I was just in shock. I was just a blank slate. I couldn't believe, for the most part, everything went pretty smooth sailing with my pregnancy. There was no complications. There was no issues. We got out to California. We got in the Airbnb. We got settled. So everything was going according to plan. And then this. So I was kind of just in shock. My husband actually started crying because he knew how much it meant for us. And so we went back home to the Airbnb that night and we just talked about it a little bit. To be honest, I really couldn't even talk about it. We went to bed, and then after some sleep, we woke up the next morning, and at that point, my husband, was like, if we're going into a cesarean, he would personally feel better, obviously, with friends and family around rather than just doing it in California under an obstetrician who we have no with or no background with or anything like that, which I agreed. So as difficult of his decision in that moment, it was like, I think that is the best decision. So we went back to the Airbnb and packed things up. and then drove back to Arizona, and reached out to my obstetrician, who agreed to have us come back into office and take a look because he hadn't seen me in 2 or 3 weeks. He saw us at 39 and 6 and confirmed that baby was in fact footling breeched. So she was head to the left and rump to the right, and then her feet were both down in my pelvis.
Okay. So she was sideways, but her feet were facing down, so they were sitting near your cervix.
So I think the way I envisioned it, she was kind of floating on her belly, head down, looking towards my pelvis, back up towards my head, and then
It sounds like transverse. It's just the feet
transverse.
were there because a
Yep.
breech means baby's in a longitudinal position.
Okay.
But their concerns are transverse but feet coming down from what you're describing, and would expect potentially once you go into labour that then if your cervix starts to open, the feet might come through, and then that would be considered a footling, or baby might have got into the breech position or decided to flip. I mean, it sounds like baby's got a bit of space to move around at that point in your pregnancy as well. Yeah, unusual position to sit in as well. Was it uncomfortable for you? A lot of women feel that transverse because it feels quite stretched.
Not really. So I had an anterior placenta, and from what I was told, that can kind of blunt some of the movement. From 28 weeks to 30 weeks, I mean, I definitely had movement, but not as much as I would have thought I would have had being that pregnant. It wasn't until really 30 weeks and on that I felt more movement. But all of that to say, no, I didn't feel discomfort with baby in that position. And I would have not even really known that baby was in that position. I know that both the OB and the midwife said that I had a lot of amniotic fluid. So they were like,
Okay.
both of them made comments about how much fluid I had. And they were like, wow, it's like a swimming pool in there. That baby has so much fluid that it's working with. So I don't know if that would have any kind of padding or something to where I didn't feel it as much, but I was never uncomfortable with baby in that position.
I was also wondering about the ECVs, how you felt with that, because this is for women listening to these stories and trying to decide whether an ECV is for them. It can be helpful to hear what a woman's experience is. And this is a rarity that we get to hear that a midwife did the ECV. We don't have that in Australia. And I know that is dependent on the midwife in the American states over there. So just curious if any medication was used to relax the muscles, and how did you feel with that experience as well? Was it uncomfortable or anything?
No medication. She just did it with palpation, and it was pretty uncomfortable. On, a scale of 1 to 10, I would say it was maybe around 7 and 8. There were definitely some times in all three of them, when I would take some very deep breaths and even hold my breath at some points. I found myself like, okay, Jillian, breathe, like you're holding your breath. But then she would stop at that time and repalpate around and then try again. So it was uncomfortable. And we did 3 of them.
I was going to say, bearable enough for you to try again, by the sounds of it.
Yes.
Yeah. Okay. So you went back to your hometown, saw the OB, had an ultrasound.
Yeah. So OB confirmed that baby was, footling and transverse. And, the options that he presented were either I could schedule a cesarean as soon as that night, or we could go home and wait for labor to start naturally. And then he's like, at that point, hightail it to the hospital and text me when you're on your way to the hospital and I will meet you and we will do a cesarean. So he was like, don't have to answer me now. Go home with your husband. The baby's safe. Everything's good in there. So go home, discuss it, and just text me and let me know what you guys decide as a family. And my husband and I went home. I also was in contact with the midwife still. And I just asked her if there was any necessity that I had to have a cesarean immediately, or if I could wait for labor to induce naturally, or even just give it more time. Like I had asked her before we left to go back to Arizona. I go, I'm a pretty optimistic person. I was like, is there a chance that the baby could actually still flip? I know that we are getting further and further and I'm almost full term, but she was like, of course, anything's possible. Baby can still flip. Is it likely? No, but is it possible? Sure. So I think there was part of me that still wanted to just honor and, let baby come when baby was wanting to initiate on its own. So we gave it more time. Once we were nearing 40 weeks and 4 days, the midwife texted me again and was like, what's going on? How are you doing? I was like, I'm still just giving it time. At that point, we actually went back and had another appointment with the OB. He was like, I don't really know what we're waiting for at this point. You're almost 41 weeks. Your baby's still in the transverse footling position. Your amniotic fluid is now starting to lessen and you're starting to not have quite as much fluid. So his opinion was, what are we waiting for? And I went back to the midwife and just text her, OB is kind of having this perspective and opinion. What do you think? And she's like, I agree with him. What are you waiting for at this point? You're almost 41 weeks. And so we just sat with that. And looking back, I had almost a full week to wrap my head around this because it was such a turn of events for me. So I'm really grateful that I had that time because it was such a shell shock of the whole plan. But I went back and texted the OB and just said, we're ready to schedule. And he put us on the schedule for that next day. Showed up at the hospital at 4 p.m. There were like 3 or 4 emergency cesareans that came in. So the OR kept bumping us back because we weren't in any kind of emergent situation. So I think it was just after midnight when we finally got up, to where it was our turn.
That's a late night and not eating.
Yeah, she was born at 12:36 a.m. on Friday at 41 weeks exactly.
And what was that cesarean experience like? Did you get to have like music, have photos? Were there things that you brought in to try and create a space that was yours?
Yes. And that was one thing that we discussed when we came back from California and just reestablishing care with him. I had said, can you do a gentle cesarean? And he's like, well, I don't call it a gentle cesarean because there's nothing gentle about a cesarean. He's like, what I call it is a patient-centered cesarean. But absolutely, I can dim the lights. I can let you have music. Was there anything else that would be important to you and your husband to incorporate into a patient-centered cesarean? So I said, yes, I love the dim lights. Yes, if I could have my own playlist so I'm not just listening to OR things happening or whatever experiences. I was like, can you delay cord clamping? And he was like, I mean, I have to pull the placenta off of you, right, before I stitch you up. And you are also of concern. So he's like, what does delayed cord clamping mean to you in this situation if you're having a cesarean? And I was like, well, can you wait until the cord is white? And to be honest, I didn't really know. Once the placenta is detached from me, does that remaining blood still go into the baby? Which I could only assume yes, rather than just clamping and cutting it immediately. So he said, yes, I can offer a 2-minute, 3-minute. So he agreed to that. We had asked about vaginal seeding. It was like, hospital protocol is not going to allow me to agree to that. But whatever you and your husband do with the baby, once the baby is with you in the room, I will turn my head and look the other way, more or less. So we were like, okay, thank you. I get it that there's evidence that supports that can be great for a cesarean.
Just for those listening, would you mind explaining what that is? Because that's not a topic that's been talked about yet.
Yeah. So vaginal seeding is offered potentially, or you can do it for cesarean birth. So if a baby is born vaginally, it goes through the vaginal canal and all of mom's bacteria and good vaginal flora get on the baby and kind of seed the baby's microbiome from birth. And with a cesarean, when the baby comes through the belly, you don't get that opportunity. And there's a lot of good evidence that supports that that's actually really important for the baby to receive. So vaginal seeding is taking a cotton swab or some sort of instrument to swab the mother's vagina prior to birth, saving those little swabs in a container. And then when the baby's born, you rub the Q-tips all over the baby's face. And yeah, the midwife said, absolutely, go ahead and do that. I think that's a great idea. Again, the provider said he would turn a blind eye to it. And so we swabbed my vagina before going to the hospital, and my husband had the little Q-tips in a container in his pocket. And when we got back to our room after delivery, we did them.
Amazing. And you can use just like sterile gauze you could get from your midwife. If anyone wants more information on the microbiome and the importance of that in pregnancy and for babies, the Great Birth Rebellion has a really good episode on this. I'm not sure what number, but highly recommend listening to that episode to boost your knowledge around this. Thank you. Anything else in the cesarean that you requested?
I requested that I didn't want antibiotics given to the baby. And that was actually when we went to the hospital and the anesthesiologist came in to talk about doing my spinal. They said that they would start antibiotics prophylactically. And I just denied them. I don't want antibiotics prophylactically, not while the baby's still inside me. After the baby comes out, if you want to give them to me, I will maybe consider that. At which point the OB came in after the anesthesiologist left. And he was like, this is a major surgery. If you don't want them prior prophylactically with baby inside you, I understand that perspective. However, once the baby's out, I do highly recommend that you have them, with it being a major abdominal surgery. So I did concede to that. But yeah, I just told him I didn't want any other interventions like that as possible. And he agreed to that. I said that I wanted baby to come to me first. for skin to skin as soon as possible. I didn't want baby taken away and going to any kind of a NICU or anything like that without my husband. I think we had probably 8 to 10 items, and all of them he honored and agreed to.
Great. So you got that skin to skin, baby came to you while you were on the table. And did baby stay with you until you went to, do you go to recovery or do you go to the ward? What does it look like in that hospital that you're at?
Yeah. So baby came to me and started rooting around, and, my arms were out on the table. So I couldn't move them in to grab her, but the anesthesiologist who was behind me was a female, and she unbuttoned my my gown a little bit and tried to help baby find my breast, which was wonderful. And baby sat with me for maybe a few minutes, maybe most 5 minutes. And then my husband actually took his shirt off and they gave the baby back to my husband. And my husband then took the baby into recovery while they finished stitching me up. And then they wheeled me into recovery where my husband was skin to skin with her. And then immediately when I was in recovery, they got me situated. And then my husband brought over the baby to me, and then she came on my chest, and then she didn't leave my chest, until we left.
That's good.
Yeah.
And did you know what you're having, or was it a surprise?
It was a surprise.
Nice. Were you the ones to announce it?
Yes, actually, that was actually another item on my list. Was I asked that my husband announce the sex of the baby. So I was like, nobody else say it. I want to hear my husband. So, yep.
Yeah. It just gives little tips and tricks for women who have made the decision to have a cesarean or don't have the option for anything else, so they can sort of take that on board and go, okay, these are the little things that I want to bring on for my experience to make it the best they can as well.
Which I never knew all of that was possible. So until I was actually there and faced with that is what I was having to do. And then I got to learn that, right? I was very thankful that all of those options were available. And not every provider allows that, right? But I'm grateful that ours did. And it doesn't hurt for women to ask, right?
Absolutely. And so postpartum, so you went to recovery and then I'm assuming to the ward. How long were you in the hospital for, and what was that immediate postpartum like after surgery?
We could have stayed for up to 4 days. At 2 days, we felt that everything that was happening we could do at home just as easily. Those first 2 days, though, I definitely felt like I needed. I had to learn how to get up out of bed, and I was actually surprised for being a nurse and have been in the OR for cesareans, right, and seen them done. Actually experiencing one myself, I was like, holy cow, this is a major surgery. And I wasn't expecting to be as set back as I was. So that was actually pretty surprising to me. Trying to walk around the nurses' station in the hospital was hard work. So those 2 days I definitely needed. But by the end of those 2 days, I was like, I can rest and recover at home just as much, if not better, than I can here. So we left after 2 days. And that very early postpartum was probably more work on my husband than what I was kind of initially envisioning, just because he had to help me. In terms of me and the baby, that part was great. The baby just laid on my chest and nursed, and we just laid in bed a little bit longer and more than what we probably would have vaginally. And I got up and tried to move around as much as I could. But yeah, that first couple weeks I was pretty bedbound and with her. So, between her and I, it was great. Breastfeeding initiated wonderfully and beautifully, and I'm very thankful for that. And I still nurse her to this day. But yeah, I guess had I had the vaginal birth, I just kind of envisioned myself after 2 days being up and kind of back to life, not entirely, but at least 70%, so it definitely looked a little bit different than what I thought it would.
Yeah. So breastfeeding went beautifully. And how old is she now?
Almost 5 months, 5 months next week.
Did you choose to do anything with your placenta? Did you keep it? Did they just get rid of it? Was there anything you wanted to do with that?
I did keep it. Yep. That was another thing on our list. So you keep reminding me of some other little tidbits, but yes, we asked to keep the placenta, and he honored that. So it sat in ice in the hospital for 2 days, and the nurses were so great. They kept just bringing in ice to keep it cold. And then when we went home, we took it with us, and it's actually still sitting in my freezer now. I was going to encapsulate it. Yeah. I still might, I may not, I don't know. But it's in there. It's with us still.
I think with encapsulating, the idea is to get that done as soon as possible.
Oh, is it?
Yeah, usually you do it quite fresh, because you got to treat it like a piece of meat because you're going to consume it. Okay. But with it frozen, you could plant it with a tree. You could make it quite ceremonial. I know plenty of mums, they wait till their child's older and they're a part of that ceremony of burying it with the tree and picking their tree out, so they understand the life force behind their journey in the womb. Mm-hmm. Yeah. And then
Yep.
I'm very aware that they can sit in freezers for years until
Yeah.
mum gets to it.
Yeah. Yeah. That'll probably be our story then, because I guess I guess that makes sense that you have to encapsulate it right away. But yeah.
Yeah, I'm not sure if anyone encapsulating would do it after frozen as well. I've always thought it had to be fresh.
Okay.
Having the experience that you've had now and knowing what you know, would you do anything differently if you had another breech/transverse baby?
Would I do anything differently? I might, if I had a breech baby again, I would probably just stay local and look for providers here that could either offer a VBAC, or rather than traveling, because that was a lot on us to be rushing, especially that pregnant. Like, I just remember when we were driving
Yeah.
back to Arizona, I just felt like so tense and nervous because I was like, I could go into labor now here, and we're in a 5.5, 6 hour car ride back home. So yeah,
Yeah.
I would probably just eliminate the travel part out of it.
And the expenses as well. And I suppose in the future, you've got a child as well. So that's added expense, and who's going to look after that child? And it's a lot more logistically having to plan.
Yep, exactly.
Was there any resources or anything? So you mentioned the services. You had chiro and acupuncture, and your midwife did the ECV. Was there any education that she recommended, or the doctor recommended around breech or transverse, or it was just getting the information from them directly?
I would say there was no information that either of my providers necessarily told me to look into, but prior to knowing that my baby was breech, I would say birthing instincts, all of the work there that they do with breech was probably where I got most of my information from. But once I actually learned that my baby was breech, there was nothing really that I looked into at that moment.
I suppose listening to that particular podcast, you probably unconsciously had stuff in the back of your mind anyway, because this Dr. Stu's talking about breech all the time. Do you have any advice or words of wisdom that you would like to share with any woman listening now with a breech or transverse baby on board?
Yeah, I would say, even though the travel portion was a part of my story and I said I would change it going forward, with if I had another breech, I'm so thankful in the providers that I had chosen. So I would say just be very diligent on who you choose to be your provider, because my midwife, I know through and through, does nothing but praise home birth and, loves her job that she does. And we have a lot of the same philosophies in mind with how we look at birth and how it is just such a sacred journey. So had I received the information that my baby was breech from anybody other than her, I don't know that I personally would have necessarily surrendered and trusted as much as I did hearing it from her. So even though she didn't deliver my baby like our plan was, just hearing that my baby was breech from her, I know is why she was a part of my story, because I needed to have that trust with her. So yeah, I would just say that picking the provider that you think resonates with you is very important for a multitude of reasons. If the birth goes as planned, or if the birth doesn't, you still have that trust with that person.
Absolutely. Yeah, I'd like to add on to that. If you are questioning it, like really tune into your gut instinct and your intuition. Does it feel right? That's part of that trust. And if you're questioning it throughout your pregnancy, maybe meet other providers, work out if there's another person that fits even better.
Absolutely. Yeah, I would agree with that wholeheartedly.
Amazing. Thank you so much for sharing your story. It's been an honor to listen to.
Yes, thank you very much for having me on and letting me share it.
Thank you for listening to the Breech Birth podcast. These stories matter. They stretch what we think we know and bring voice to experiences that need to be heard. I'm so grateful to the women who have shared their experiences with us, raw, real, and full of wisdom. If this episode resonated with you, please follow, share, or leave a review. You can find us on Instagram, Facebook, and YouTube at Breech Birth Podcast. And if you have a breech story to share, I'd love to hear from you. Until next time, may we continue to reclaim the narrative, one story at a time.